We are 1 month away from psychedelics being legal in Australia. So those psychedelics that will be legal include psilocybin and MDMA for patients with PTSD and clinical depression. This video is going to go into a little bit of depth about what that means and what are the differences between you as a patient that is able to get a prescription through your psychiatrist to access psychedelic medicines compared to the other option, which has already been set up via a pathway that exists in Australia, which is clinical trials into psychedelic medicines. We're going to drill into a number of different points, so let's get going. Okay, so the first thing that we're going to look at is cost, right? So let's drill into cost immediately. And we did a post not long ago. We did a post at OnTracka. If you don't know OnTracka, this is who we are. This is what we're about. But we did a post a little bit ago that went into the cost that you can expect to see in Australia if you are a patient that's considering these medicines. And just as a ballpark, we're seeing it's going to be a minimum of $20,000 to be able to access these medicines. Now, while we're looking at Australia, we see that there's a lot of movement happening over in the USA, and then we're watching closely towards the UK to what is going to be happening there as well. Obviously, several other countries around the world as well. Our key focus is looking at the UK, US, and Australia for the time being. So what we're going to see is $20,000. Most of you are going to be like, well, this doesn't exist. And we saw an article that said, that talked about the division that can occur in society due to classism, and that psychedelics may be medicines for the elites. So when we're seeing $20,000, and when we did that post, we saw some of you were saying we're almost crying because we're so proud that these medicines are going to be here, or that we're crying because I'm finally going to get relief. And then you see that the medicines are going to cost $20,000 and you're left in a situation like, well, what does that mean for me? So what does that mean is that what we want to look at is how we can get these medicines cheaper. How do we get these medicines cheaper? And to do that, we need reimbursement paths, ways that we can get insurance companies and government to be able to substitute the cost of this so that we can have greater access. So costing, we're looking at $20,000 in the community versus a price that we're going to get to for the clinical trials. But let's just drill into this idea of classism. Do we think that there is going to be a classism, or do you think that there is going to be medicine for the elites? And that is one way of looking at it, and we can definitely see that as well. Is this just going to be something that people with the means to afford it can have? And if that's the case, there is no access, particularly if you don't have a diagnosis of clinical depression or PTSD and you haven't exhausted first-line therapies, you're not going to be able to access these medicines. So that could be like, well, that leaves me with no options. It could be the clinical trials. But there's another way of looking at the costs, right? And to do this, we need to take a little bit more of a longer approach. And we're not saying that this is right, but let's use flat screen TVs as an example. What we're looking at here it isn't subject to the medicines that we're talking about, but just in terms of general adoption. Generally with technology, when it hits the market, such as flat screen TV, we're going to see that at a certain price point, which is beyond the means of the everyday person, right? And what we see is that over time, that price comes down. A classic example of this is the Apple headset at the moment. It's come onto market for a minimum of $6,000 US. Again, not going to be in the price point for many of us at this stage. Apple are going to be able to reiterate on that project, get it better, bring the price down over time, and then we'll see greater access and greater use. So if we use that example with psychedelics, the people with the means in some ways can be seen as the guinea pigs. Yeah, they're going to be studied. They're going to pay for that out of their own pocket. And then we're going to have the evidence to see, are these medicines safe, and how they've been used? Are they safe? And has it been effective? And if so, it presents a very strong case to look at reimbursement parts, as mentioned before, to then look at greater access. So 2 ways to look at that. It's going to be a division in class, once again, that some of you may think, or it could be, hey, the people with means are going to be able to pay for it, and they're the guinea pigs. Now, That's in the community. If you're to access clinical trials, and the clinical trial pathway was set up by the Australian government, which we need to kind of give some applause to. Australian government set out with an initiative to be able to study psychedelic medicines, and that has been in place well beyond the TGA's decision to be able to down schedule these two different compounds. They set up a fund of $10 million, right? Very good start, and applause is needed, but it's $10 million when we consider the market size just for depression. 30 million prescriptions done every year gives us a bit of an understanding around the disparity between what's currently in place in terms of the typical psychiatric medicines that are being used and these emerging psychotropic medicines that we're all very excited about. So clinical trials will be free, but it does come with a few factors to be mindful of. Firstly, you could get a placebo. So you could be part of a study and then you're part of the placebo group, which means you don't actually get the psychedelic medicine, or it could be that you may not get the psychedelic medicine during the first session and it may be the second, but either way, you got to be mindful you may not actually get the psychedelic. So that's something to be super mindful of at the beginning, but that shouldn't be something that deters you. It's just something to be mindful of. You will be getting it for free and there may be additional reimbursement associated with that. That also may come with different expectations. Those expectations could be rather than with, if you're familiar with OnTracka, and you're reporting in terms of your symptoms or your dosing, and you're maybe having a capacity to score what these medicines and the effect they have on you, and saying, oh, my depression was here and now it is lower, or my anxiety or my stress or other areas are part of your healthcare. That is what we've seen. But with clinical trials, it may be blood work required, it may be brain imaging, it may be other requirements because there is greater rigor that is associated with the clinical trial pathway. So cost, huge factor, $20,000 versus free, does come with some different requirements as mentioned before. Access, you need to have clinical depression or you need to have PTSD to be able to access these medicines, whereas clinical trials may be open for a wider range of indications, i.e. areas that individuals are studying, and that includes healthy individuals at times as well. The access isn't just for MDMA and psilocybin. Psilocybin, if you don't know, is what many of us once knew as magic mushrooms. I see it's a wonderful branding exercise to reintegrate a very powerful and complex medicine back into mainstream society and remove some of the stigma that's associated with magic mushrooms. What we're doing with CBMs, cannabis-based medicines, is a very similar exercise. Language is very important to changing culture, and we do know that we are living through a huge cultural shift at the moment in many ways, particularly when we're talking about these medicines, where we see a once-in-a-generation lifetime where we're seeing a transition of these medicines back into mainstream society, and we are just at the forefront of this. That means there's excitement. We want to be part of this. We see a broken system. We see friends and family members, sometimes way too often, that are subjected and have a lot of challenges with a broken system, and they fall through the gaps, and there are dire consequences for community. So there's a lot of hope in what these what these medicines can bring to us. So we need to do research so that we can heal the world. That sounds a little preachy, and I'm sorry for that, but if we have a look at the cousin of psychedelics in some ways, that is CBMs, and they have been available in Australia for many years now. And many of you may start firing your arrows at me, but I think there's a lot of lessons from cannabis and the prescriptions and the way that patients and quality of care has been provided in Australia. I think we can do better, and I think that needs to be mentioned that there are many wonderful prescribers, many wonderful companies, and many wonderful individuals that are all in it for the right reasons, to have legitimacy and credibility as a medicine. But we do also know that there are other players in the market that don't even do follow-up, that are prescribing certain products to individuals that don't suit their requirements. And there are other issues with the industry. Again, fire your arrows at me, but just in response, show me the data. Show me the data to show how effective these medicines have been for key indications. You know, this is a maturing market and we still have a long way to go, and simply we're not there, and we should be better, and we need to learn lessons so that these newer compounds, i.e. which are going to be available, MDMA, psilocybin, all have the right scientific data around them so that we can make it more accessible and we can have more conversations with policymakers and different organizations that need to get on board with this. And we're pretty sure that it will. We're living through the golden age of psychiatry, which gives us a bit of an indication. I've gone way off track. Key issues: access, cost. Now, with research, regardless of what you do, if you're going to be accessing these compounds in the community, you are going to be part of an ethics-approved study, which is wonderful and follows on from what I just mentioned before around CBMs. That'll mean that there will be an element of standardization that occurs for individuals accessing these compounds in the community. So that's where we're at. It's a quick summary. It's a longer version than what we usually do. If you don't know who I am, my name is Chad Walker and I'm the founder at OnTracka. OnTracka is a company, an electronic data capture company that does clinical trials and real world evidence, and you can also use it anonymously. And what we're doing is filling the black hole of data that exists around cannabis, things like ketamine, psilocybin, MDMA, ayahuasca, and more. We're very interested in being part of this once in a generation transition of where these compounds can change our communities for the good. And we are there building the infrastructure and collecting that credible data. And if you want to be part of it, there's many opportunities for you to jump on board and join the journey. Join the journey anonymously by recording your effects, what happens to you when you have medications, what happens to you when you take maybe antidepressants or anti-anxiety medication, because we need to make comparisons. But I don't want to go too much longer. Go check it out for yourself, or ask myself or the team to give you some guidance. We're super excited about where we are, and we do believe there's an opportunity to be able to change the future of healthcare together. We hope you enjoyed this longer term video. Open to any comments. Let us know what you think below. Thank you very much. Bye-bye.